The participant accesses the mixed reality therapy room's virtual environment in 3D by putting on a virtual reality head-mounted display, or in 2D on a computer screen. The platform is built to facilitate both local as well as remote collaboration, as appropriate. Having done so, they find themselves in a virtual consultancy room. This can be just a virtual space used in its own right, or the virtual space can be layered upon a physical consultancy room to create an even more compelling experience. The consultancy room draws on conventions in therapy room design in order to feel familiar. It allows for customization to accommodate individual user differences and variation of therapeutic approach, with different themes that can easily be switched between as needed. When we look around the consultancy room, we can see some of the typical elements we'd expect to find: a couch for the client or patient, a seat for the practitioner, tables and some other furniture. In front of the seating area is a screen. This can be used to show therapeutic content, prepare and review exercises, and display data. Across from the seating area is a doorway that leads into a second adjoining room, the experience room. An important part of the design is the separation of the experience room and the consultancy room. This is a deliberate attempt to create a behavioral distinction between the consultancy room, as that secure base where orientation and reflection can happen, and the experience room as a place of adventure. When considering user roles within the mixed reality therapy room, it can be helpful to think of 4 main types. The first is participants. These are the clients or patients who are entering the space with a therapeutic or educational goal. The second is the guide. This is the therapeutic practitioner or facilitator. Their role is to guide the participant through the space. In serving this role, they straddle an incorporated perspective, being there in the exercise with the participant, and a system-level perspective, thinking ahead to what parts of the scenario should be run next. The third role is the operator. This role may be filled by the same person as the guide role, or by another person if they would prefer support so that they can focus more fully on working directly with the participant. The operator will keep an eye on what's happening in the experience from a technical standpoint, loading content and adjusting settings as needed. Finally, the architect role is a designer of the space. They are not present during applied work and serve to maintain and improve the platform's various processes and resources. These roles are a helpful way to think about how the space is utilized, but are also very important in terms of the security and build of the platform. Within the experience room, a variety of different types of interaction can be facilitated, some more symbolic, and others more photorealistic and immersive. Because content is being introduced and manipulated, it becomes essential to know who has control over what and when. For this reason, these roles and safeguards surrounding them are built into the system from the ground up.